whenever you have such problem, please always visit to the nearest your physician, neurologist, connect to the MS Society, join support group online or in person, consider working with the experienced therapist. So knowing about the illness is the knowledge is what we say the power. So identify your symptoms and then you get the seek the medical proper assistant. And remember, you are more than your diagnosis. So while MS is a part of your life, it doesn't define who are you or what you can achieve. Always, so that you need to, for which you need to follow the support group, which has been mentioned in the slides. We have email and helpline, so that will help the help in the other aspects. So with this, I think I have finished. Is any other slides? Next slide. Okay, I think I have finished. With this, I finish my talk, and I'll request other speaker, Dr. Hassan sir, to carry forward. If any questions, I'll be happy to take at the end of or during this session. Thank you.
Thank you so much, Kiran sir.
Right.
Thank you for your kind words, and it was nice to hear from you and some known tips, but it's always better and good for every one of us to hear it. And about medication, the word justifiable, which you used, is a very good thing which struck me, because it's a long process to get treated. First, we have to manage the illness, and then, of course, with the latest drugs available, we can avail of it, but it has to be justifiable with my profile, my age, my current situation. Yes. So that's a very wonderful word, Kiran sir, you used. And I think as we progress, and I tell Dr. Hassan to start his slides, we'll have a question answer session for sure after Dr. Hassan finishes. And I'm sure we'll be having an interactive session, which is the ideal purpose of such an interaction. And I think, yes, Dr. Hassan is okay with Bengali, and we can use Hindi and English also. So be clear about your needs and questions. Dr. Hassan, can you please start this slide? Thanks.
Acha, Anirban, so one thing, just give him a call. Basically, I received a message from Dr. Hassan at 7:33. He mentioned that I have to leave. There is an emergency of one of my patient. Sorry, I don't have any option. So just if you can give him a call, means whether if he's done with the patient. Otherwise, after a minute, we may go ahead with the question answer session with Kiran sir.
Yeah. I think, team, my MS friends, I think while we try to contact Hassan sir, I think if you have any questions for Kiran sir, you can ask him, so that we can find out about Hassan sir. Okay? Thanks. Kiran sir, maybe you'll have to answer some questions that Dr. Hassan has some emergency, yeah?
No issues. If anyone has any queries, questions, I'm here to answer that. That's not an issue.
Thank you so much.
I'm Parthurai from Kolkata. My age is 57.
Right.
Sir, I'm curious to know about the remyelination. Is it possible or not?
Remyelination or demyelination?
Remyelination.
Okay.
Not
yes.
D. D we are having D.
Right. Understood. Now, what you're yes, it's very valid question. Yes, it is always possible. Remyelination is always possible, but there is certain time frame or certain there is. That's why we say always seek the medical attention. Treat the treatment at the start the treatment earliest. So what your damage, because it's the only tissue in the body like brain on its coverings. Once it is get damaged, there are very few chance to get recover from it, because it's once it is permanently damaged. So always seek the medical attention. For remyelination is concerned, so you have to there are various drugs in there are various trials are there, about the 7-8 trials ongoing regarding remyelination. Some patient has been, in some of trials, they have used biotin like 100 mg thrice a daily. They have been proven. Then there are few medications. I mean, exactly, there is remyelination is separate topic altogether. But yes, it's possible. Remyelination is possible, but it is not whole and soul treatment. It is supportive treatment. Like they have trials on the coenzyme, atorostatins, high dose atorostatin, biotin, and there are few medication. There are 7, 8 trials have been. I will sprint trial, MS sprint trial, or something. There are few other names are there. Yes, remyelination is absolutely possible, but this is not main treatment. Main treatment is disease modifying therapy. This is supportive treatment. Yes, it's possible.
Sir, this is Prasanjit. May I ask a question, sir?
Definitely, please.
Yeah, this is Prasanjit Chakravarti from Guwahati.
Right.
You can say a severe multiple sclerosis patient on
Okay.
wheelchair since 2008. Now my
Okay.
question, sir, is if somehow the disease progression stops, I mean, if the inflammatory process stops, I mean,
Yes.
in whatever way,
Yeah.
will the body try to repair itself by, say, repairing the CNS?
Yes, partially I will say yes, because whenever ancient days there was no treatment for anything, people were not about the disease, but patient used to get cured. So in that way, it is always body's mechanism try to protect, whether it is multiple sclerosis or any illness per se. But in multiple sclerosis, always it's not possible to repair whole things if patient has been reached to the bedridden state. So it is very less chances to get repair on its own, what I believe.
Actually,
And yeah,
sir, this has happened to me I've come across from the bedridden state. I mean, are there any drugs to, I mean, push this thing, and that is repairing the CNS?
no, because you have passed what you previously what you used to practice in multiple sclerosis. People used to wait for second attack, third attack. Once patient is disabled, then go for the high-end therapies. Nowadays, treatment is different. Nowadays, on first attack itself, I mean, some people get offered good high-end efficacy therapy. So this situation won't come. But your question, what you are saying, you are bedridden, you said?
I was totally bedridden, but nowadays I am able to transfer to the wheelchair, not
Okay,
bed
so
bound
that's
100%.
because you said neuroinflammation. So
Yes.
during young age, it is always inflammation. Over a period of what happen, it turns into the neurodegeneration. Yeah. So
Okay.
over a period of time, I have seen the few patients, though some patient doesn't require treatment at all, and they remain stable throughout the over a period of time. Usually after 40 to 50 years, there are now
Yes.
guidelines so when to stop the treatment also, because you can't take the throughout the life till 80 years. There are guidelines to stop the treatment also in MS once you are started.
Currently, I'm at 50.
Yes. So once your disease is stable, guideline says now it is 65 years. If there is no fresh attack and there is no disabling new MRI changes or no clinical attacks, and you have crossed your 55, 65 years. Means if you say scientifically, it is 65 years. But practically, if your disease illness is stable over a 7 to 7 years, you can, I mean, there's supportive treatment not required any definitive
Okay.
treatment.
Let's
And
hope, sir,
yes,
some CNS repair drug arrives soon.
no, that's body try to repair on its own. Now, whatever, see, young age has been passed up to 45 years, usually reproductive age group. That time, usually whatever damage has been happened, and you must have taken some treatment. Now, automatically it try to help in such a in small way. So, I think you should be over a period of time better enough.
Okay, okay. Thank you so much, sir.
Right.
Sir, what is the cause of this demyelination? I mean, multiple sclerosis. Is it hereditary? One of the causes is hereditary or not?
No, not editorial. Yes, see what does they says there are few genetic association is also there, but what common is that person who smokes, person stays in the vitamin D3 deficiency state, then person who have post-viral infection like EBV virus infection in childhood, and that has an association with that. but definitely it's not an hereditary. It is an altogether inflammatory condition. It is
Okay,
not
sir.
like if I get the MS, my child will get the MS. Not at all.
Okay, sir. I'm clear now. Sir, what is the cost of the oral medication that you have told earlier?
Okay. Depends on the what medicine you are taking. We usually start with the now basic treatment.
Actually, sir, I am taking rituximab only.
Okay. So rituximab cost is what we used to get in, pediatric, because it was they used to give 15-20,000 for I think 1 gram or 500 milligram. But market price I think 45,000, right? But
No,
with
sir, it is nowadays it is 16,500 to 18,000. Varies.
for
Varies
for
on the
500
distributor.
for
Yes, sir.
1 vial. Okay.
Sir, one gram.
1 gram. It's very minimal then. Then uh, we used to also get 12 to 15,000 for 1 gram. But I think market price, what I have seen MRPs, we
MRP
don't
is
come across.
pretty high, sir.
Yeah, okay. So, but rituximab is not approved in multiple sclerosis. Though patient are, most of patient now, I have a young girl, she's been a medical college student, started, she had some myelitis attack, and since last 1 year, she's been on rituximab. So, now we have options. Rituximab was there was the period where we don't had any option. So it used to been used by all the neurologists across the globe or country, right, left. Now we have very option CD20 because we have come now latest CD20 like ocrelizumab hai, ofatumumab hai. If affordability is there, always go ahead with the good one. Yes, cost also matters because ocrelizumab has
So
cost
what?
almost.
So, sir, what is the cost of that medicine? And what
Which
is
one?
the dose of it?
Okay, okay. So anti-CD rituximab is one medicine. If in simple language I will say, so if you give the rituximab, only 1% goes inside your CSF or CNS. है ना? In simple language, I am just talking simple. Studies have shown if you give that drug, whatever is 1% is available. If you give the advanced medicines like ocrelizumab or ofatumumab, and there are one more anti-CD20 inhibitors, they have and they are purely human monoclonal antibodies. They are not pure human monoclonal antibodies that like rituximab. So this ocrelizumab and ofatumumab almost they are human means similar to as human monoclonal antibodies. It's almost 65%. I think ofatumumab is 95%. So technically speaking, they are having less side effects and they are much more efficacious and it is scientifically proven. It's not my
Sir, I
own data.
understood that, but what is the cost of that medicine?
Okay, ocrelizumab, I think market price is 3 lakhs for 300 milligram. I, 3 lakh or 4.5 lakh. I'm not right person to talk about it, but
So, what is the
uh,
dose of that medicine?
yes, dose is that we usually give is 600 milligram in a day. Suppose if I have to start like rituximab, you get the 1 gram. So ocrelizumab, we have 600 milligram on day one. After 2 weeks, 600 milligram. Uh, Initially 300, then repeat after 2 weeks 300, and every 6 monthly 600 milligram means 2 vials. So each vial contain 300 milligrams. So it cost around I think 4.5 something lakhs every 6 monthly.
Sir, it's don't you feel that it's a hardship for us to
Yes,
spend 6 lakhs in a year
definitely.
uh, with the medicine?
I agree. I agree. I agree. But because price and marketing is not in your hand, and US and other countries they have insurance base. We don't have
Sir, we
insurance.
have also insurance, but they are not covering our treatment and treatment cost.
No, no,
That's
they
the
should.
whole thing, and government not at all interested about that.
Okay. So in such cases, I think see government can't implement these are latest medicine because it has its financial implications. You know, because one single drug,
Sir,
if
I
you
requested them.
Hello,
Yes, sir.
can I have one question? This is Orko Sinha from Calcutta.
right, please speak on.
Yeah, I want to know, sir, as you mentioned ofatumumab. Now, which brand of ofatumumab is available in India? Because in outside India it is Kesimpta, but in India we are not getting Kesimpta. we
Hmm.
probably is getting bone spree from Novartis.
Yes, yes,
So
yes. I think it's
how,
only, yes. This is only what you're talking is the same brand. It's been marketed in India because previously it is not used to get it in India. So this is Bone Spree. I think same brand. It is same brand because
okay.
I don't remember the brand, but it is the same person who comes. With, I mean, medical representatives. They have been talking about the same. So it is the one and the only brand I think across the country.
Do you suggest taking ofatumumab will be a better option because it is once a month, so even your immune system weakens a lesser amount compared to rituximab or ocrelizumab because it is 6 months. You have to retake
See,
it
this is
decreases to
understood.
CD20 to zero.
See, understood. You are, I mean, I will clarify between ocrelizumab and ofatumumab. See, one is, this is always the patient choice. Doctor never enforces कि you should take this one or you should take this one. Patient choice should be based on two to three things. One is patient condition at which it is been started. Second,
Mhm.
cost of medicine, affordability. If patient is affordable, then because that ofatumumab I think cost around 9 to 10 lakhs per year and ocrelizumab cost 4 to 5 lakhs practically speaking per year. And duration of interval because ocrelizumab has to take 6 monthly, every 6 monthly infusion, and ofatumumab used to take initially after 4 weeks weekly, then monthly, that subcutaneous injection. So it is choice between the clinician, in patients. It's always the choice of patient. But it is depend on you whether you want to which bike you want to purchase, whether that is Harley Davidson or some other brand. That's up to uh, patient choice, what I believe.
So otherwise, there is no difference between ocrelizumab and ofatumumab in case of efficacy and all.
No, no. Scientifically speaking, there is difference. I can't say no because scientifically speaking, there is difference. I can't say no as in I'm
Oh, and
uh,
also
because
because it makes you more infectious because of the immune system suppression, is it a better way to use ofatumumab because you know your CD20 comes back every month and you are supposed to take one monthly, whereas in rituximab or other mab it is 6 monthly because it goes to zero and it takes 6 months to come back.
no, I will not say it's like that. Rituximab goes and up. So it is basically immunosuppression. Yes, half-life of ofatumumab is 3 weeks, as you correctly pointed out. Ocrelizumab is longer, so it takes 3 months to come up. That's correct. But medicine, you need to hospitalize. You need to give some preventive medication like hydrocot to avoid the anaphylaxis reaction or some side effects of that. Another medicine doesn't require. You can take like in insulin pain and subcutaneous. It's always choice. But yes, there are some few technical points. Choice is always been between the patient if provided the options are given. What I says.
Okay, thank you, sir.
Good e-
Parthoda, I think you asked asking something. I'm sorry. I'm sorry. Parthoda, did your question get over? Like, I think. Anyway, I think someone else was trying to say. Please carry on. I'm sorry.
uh, Good evening. Sir, I have a question. I
Right.
have been diagnosed with RRMS in 2018.
Right.
Since then, I was stable. Like, I used to do everything. I used to go to office. I used to take the local transport and everything. I
Okay.
was absolutely fine till 2020, till the time COVID struck. And then we
Okay.
had to do this work from home, which
Okay.
actually rendered me, it actually gifted me with a lot of spasticity because I was seated at home, I was doing work from home.
Understood. No physical
Uh,
activities.
yes, due to lack of physical activity, my spasticity or the disability, whatever you call it, that increased to a certain level.
Okay.
Now, I have completed 3 cycle of rituximab already.
Okay.
However, instead of taking a progressive state of
Okay.
my condition, my disease is progressing. So I
Okay.
am becoming more spastic. For
Okay.
example, I used to walk around with the help of a cane. Now
How
I
long?
am using a walker, and sometimes I feel so spastic that I get on a wheelchair. So I was told I'm getting my medical treatment done at BIM.
Uh,
So
uh-huh.
the doctors told me that I have moved on to SPMS now. So I was
Yes,
very
absolutely.
unsure that what is the future of the disease and how to combat this situation, because I cannot let this happen to me. I have to do something so that at least I can figure out a way where I can
Yes.
support my daily activities. So sir,
Okay.
if you could please tell me, how should I go about it?
What the age of your right at present, madam? Age at
I
present?
am 40 years old.
On how long the disease you had till now?
8 years.
Yeah, 8 years. So COVID means
Yes.
5, 6 years. Also that time it was progression. So it is clearly, I mean, your neurologist has been, it's very clear about your diagnosis and illness. Only thing
Mm-hmm.
that what across the globe also what is study has been found, SPMS diagnosis almost we take 3 years delayed, even in other European countries also, to label the SPMS means secondary progression. Nowadays,
Okay.
I mean, so your diagnosis is clear, no doubt. Your EDSS, what we call quantify your illness
uh,
on base clinically EDSS. Your
yes.
EDSS must be 6.5 to 7 somewhere like.
No, they have marked me at 5.
Okay, but you said how much you able to walk with walk with support with how much you able to walk 100 meters 200.
No, I cannot walk for a long time. Like if I'm walking for say about 20, 30 steps, I need to rest. There's
So
a lot of
no.
fatigue and I just can't.
Understood,
Yeah,
understood,
sorry.
understood, understood. So your EDSS must be more than six, if, because there are
Okay,
tools for that. You can also check online EDSS on depending on how many meters you walk. That EDSS and functional status severity score can be calculated. That
okay,
is just a clinical aspect. But to combat your condition, because you are, a working woman, so you have first of all you have come to the right forum, right doctor. Now question is about the treatment. So for SPMS guidelines, which very clear cut, you should have the high end efficacious drug. We have seen the, if affordability is not an issue, then rituximab is now, I think, should switch over to the newer CD20, like anything what is your choice depends on your affordability and choice and your preference, like ofatumumab or ocrelizumab.
10
Then
লাখ
even
এক বছরে
even if it is that is not an if on that also if you have some relapse, then last what I we have seen the one or few patients of alemtuzumab, which is 30 lakhs medicine. So
okay.
yes, treatment option is there, always there. You are in that correct. With the correct physicians. So don't worry about it. It is the just you need to hit hard. That's what I mean. If you don't have any affordability issues, request to kindly switch over to the higher end medicines as per the your preference. Consult your doctors.
Okay, like in the month of May, last month, I took rituximab. So,
Hmm.
if I have to switch over to the
Switch over.
higher efficacy medicine,
Right. Right.
when can I go for it? Like, do I need to give some, a cooling phase
Yes. Yes.
before I
Yes.
can shift to the?
There is see
So,
some understood question. If do the CD19 levels at the end of 3 months, if it is more
mhm,
than 1%, you can always switch over to any other drug, preferably CD20, whichever you want. That's
okay.
my
And if
advice.
it is less, then should I?
Then you should wait because thing is that you are already in immunosuppressed state. So there is no point in again adding the same medicine which will going to suppress your immunity. So please wait for at least 3 months. Usually Retux gets 3 months, and then after 3 months we do URI monthly for next 3 months. Once more than 1% of CD19 level, it then we reinstitute the, so I think please wait for a while, and then if it is CD19 is more than 1%, switch over. There is no harm in that.
Okay. And so,
And
regarding my diet and exercise, will that help? giving me
Definitely. It will
it
help
will.
in yes, definitely exercise. And are you using baclofen? I think you should symptomatic, because
Yes, sir.
symptomatic
Yes, sir.
treatment also matters. You have spasticity. I know it is not able to, you are not able to walk. That's the legs must be becoming very stiff. So it is very
It
problem.
is.
You must be facing. I know the what problem you must be facing. So please use the baclofen in adequate dose with your physician. Then use the cane to avoid the fall. And once it is adequate dose of baclofen, vitamin D3 supplementation, I think you should hit hard with the whatever your choice of anti-CD20 which are available.
So one more question. Probably this would be the last question.
No
Regarding
issues.
baclofen that you said, I have
Yes.
been advised to have 1.5, 1.5, 1. Okay. So
No,
what my question is it like, will I become resistant to this drug if I have,
no, no,
if
no, not
the
at all.
dose,
No, not
not
at
at
all.
all, right?
It is nothing like resistant. We go from 30 milligram to 120 milligram per day. So it comes in Excel
Okay.
format. 30 XL BD TDS you can take. There is no, I have seen the patient who have been using the baclofen pump also, not in multiple sclerosis, but other uh, conditions. So don't worry, baclofen is very safe. We go up to 120 milligrams. It
And
is
I
no
was
treat.
so hesitant. Probably that is one of the reason for my,
No, no,
increase of spasticity.
no, no, you.
One of my, sorry, I'm sorry. Please go ahead.
So basic is half treatment doesn't help. Please take the full treatment.
Right. Sure. Sure, sir. I'll do that.
Oh, and
Thank you
Very
so much.
grateful. Any other questions, please?
Can I ask one more question, Orivanda? This is Orko.
Yeah, please. No
Yeah,
issues.
one more question, sir. You were talking that some other secondary treatment, helping treatment like biotin we can take. Any idea of like what amount of biotin you
uh,
can take daily or weekly that will be
100
safe to the
milligram daily.
body?
This is 100 milligram thrice daily.
100 milligram thrice daily. Okay, okay. Thanks a lot. Thanks a lot.
Any questions, please? Because I think if we don't, then we'll have to wind up because it's very unfortunate that Dr. Hassan had an emergency case and he's out in a hospital and he might not be able to join the webinar today. We'll plan for it sometime later. But any questions for Colonel Sir, then you're most welcome to ask. Then we'll wind up soon after your question answers are over. Yeah, thanks.
Sir, can I ask one more question, please?
Yes, you can ask, because other speaker has no, I have to his time. Right.
Sir, I have been, advised to take Myotop 150 as well.
Which
So
one?
I believe this is Myotop 150.
What is that? I'm not aware. Means what the
It
medicine drug?
is, yeah, I'm trying to look at that only. Okay, 1 second. I'm just trying to look at the composition.
Because you are talking about trade name, I'm not aware of that.
Yeah,
Generic.
yeah.
Sir, may I ask you another question, sir? Prasanjit here from Guwahati.
Please speak on.
Yeah. Uh, is there any connection between the serum levels of lymphocytes and multiple sclerosis?
These are all research questions. No, but practically speaking, don't look into this molecular aspect, because uh, there is, truly speaking, I will not able to answer in a scientific way, but these are all minor aspects. We don't look into that. This
Okay. Thank you.
leukocytes.
Thank you.
Yes.
Okay, thank you, sir.
Doctor, I think that medicine which is madam asking for, it contains something
Oh,
tolperisone
tolperizone, right,
150
right.
mg. Yes,
Tolperizone, correct, correct.
yes, yes.
No,
Thanks,
I'm
Rakesh.
I'm I'm not.
Thank you so much.
Uh,
Yeah, tolperizone.
uh, is it no, why it was given?
Um, because of my spasticity only, I was given tolperizone. I was given gabapentin 300. First, I
ठीक
used
है
to have
that.
it only once,
हम्म.
and now they have actually prescribed me twice a day. So,
Okay. ठीक है
with
that
lot of medicine, I
gabapentin.
get,
Okay.
yeah.
That all symptomatic supportive medicine. Gabapentin is also just pain and neuropathic pain. Basically, we have main
Uh-huh.
issue is baclofen has increased.
Understood. And so regarding the heredity part, which one of my friend has also asked that whether MS is heredity, I mean, it get passed on to the next generation or not. Since
Not at
I
all.
have, MS, and I don't know whether I had it while I conceived my child, and now he is 9 years old, and
I'm very clear,
I
madam.
am
Uh,
yeah, I'm actually worried that will it ever, does he run a risk?
no, not at all. I am very clear on it. There is no data suggests it is hereditary. It is not hereditary disease at all. Only
Okay.
thing, if twins are there, one twin getting
Hmm.
MS, multiple sclerosis, other team has 50% of getting MS. But it is not next generation. It's
Okay,
very clear.
understood.
It's very clear. It has nothing to do with fertility or hereditary. So don't
That's
worry
such a
about
relief. Thank you so much.
Anirbandha, can I ask one question?
Yeah,
it. Please.
sure.
Dr. Saab, good evening. Dr. Saab,
Thank
my daughter has been diagnosed with RRMS.
Okay.
She's been on medication since 2014, and presently she was till last year she was taking Obagio, oral medication. Then thereafter she has conceived. She is now in her 8th month into of pregnancy. So
Okay.
till now she is stable. There is no relapse or there is no um, attack or
Okay.
things like that.
Okay.
I understand that once she delivers, there is a fear of the disease coming back with great
I got your question.
intensity.
I got your question. What's your what the medicine she was on? She is on.
Obagio till last year, she
What is
was taking Obagio. Then she
what is
discontinued
that?
it
I didn't
for
get. What is that?
Obagio, doctor. Obagio, Aubagio. It is, I think, teriflunomide, doctor.
Teriflunomide. Oh, teriflunomide.
Teriflunomide.
Which I think it must have stopped it. I think it has to be
Yes,
stopped.
yes. Before pregnancy, it was
Yes, yes.
stopped, and then she was washed with charcoal powder that doctor advised. So
It's
that she
okay.
has done.
It's okay.
And
That's not an issue. Teriflunomide is moderately efficacious drug. It has to be stopped prior to planning of pregnancy. Anyway,
yes, yes,
so
that we have done.
your
So
question is
my question now, doctor, is that
understood. Understood. I'll just answer. Wait.
yes, sir, yes,
So
doctor.
your worry is that whether this is going to clear or not. So I will tell the data. In multiple sclerosis, you must have read also, 30% patient will remain stable,
Mm-hmm.
30% patient will going to clear, 30%
Mm-hmm.
patient going to improve. Okay. So it
Okay.
usually happens in the end of pregnancy and up to 3 months of post-pregnancy. So in your case, like in your daughter's case, so
Mm-hmm.
she comes in which 30% that God knows.
Of course,
Okay.
that is true.
But if she has till date, I mean, she is 8 months pregnant and she has not had any attack with the, I mean,
Mm-hmm.
of medication, don't worry. She will not going to have any, usually won't going to have flare. And if at all, if anything happens, there are all medicines are there. Don't worry about it. These are minor things.
Thank you, doctor. That's a big relief. But is there anything we can do to sort of prevent that, or some precautions which we can take at this stage, which may
No, no, no. At present, you don't. think, I mean, you are excessively worried about, please don't think about it. But you
Okay.
should consult the neurophysician if anything you feel alarming of
Of course,
any
of
new
course.
symptoms.
Definitely, we'll do that. Thank you, Dr. Sir. Thank you. It's a big relief.
Thank you, Mr. Kothari, and all the best to your daughter for her
Thank you.
delivery. Yeah,
Thank you, Anirbandha. Thank you.
most welcome, sir.
I think I hope I have answered all the questions. If any other questions are there, if not, then I think
No, indeed, sir.
Yes.
It was a great interactive session. So you have gave a very good time when you listen to everyone, and we really enjoyed your eloquent speech. Means it touched upon everyone. In near future, also we are keep on conducting the event. So I'll request Anirbandha and other dignitaries of MSSI uh, to take such initiative in near future as well. So such insightful and impactful interaction would empower patient, would help patient, it will help to break certain myths. Okay, so the objective is that the disease has to detect early, medication has to be start early to prevent the disability. So what do you, Anirbandha, just contribute the concluding word. And once again, my deep and heartfelt thanks to Colonel Sir for his eloquent speech and for his impactful and very insightful contribution. Thank you very much.
Absolutely. Thank you, Devjyoti. Thank you to you and the Roche team for helping us. And of course, Kiran sir was brilliant in his answers, and I was very happy to see how interactive the sessions were. So yeah, I think the message for everyone, and as rightly pointed by Kiran sir, and we have kept on saying, all our MS friends must remember he or she is not alone. We are all fighting it together, some a bit more, some a bit less, but we are all in the same boat. And our journey, and there will be storms, but I'm sure we'll have happier days very soon. And we should stay connected, as even Kiran sir was saying. It helps a lot if we know that we are not alone and we are all fighting. There's so much psychological aspect apart from neurological things which all leading neurologists I interact, they are now acknowledging, and they have said to me, we never thought how much it affects mentally to the person suffering from MS and even their caregivers. So we should think of everyone, and we should be ensuring that everyone is happy and everyone has least worry for us, and we should take the medicines as advised by our neurologist. We should not do self-medication. We should not go for any other alternative. None, we keep on getting so many, but yeah, you should know your body. You should study your body. No one knows your body, your symptoms better than yourself. So please remember that and continue the fight. We are all together, and I'm sure with support from drug major like Roche and such senior doctors of the city. It's very sad that Dr. Hassan couldn't join because of an emergency, but I'm sure we'll be connecting soon. And I would request that we stay connected and we take care of ourselves. And I think, Devjyoti, it's my way to wish everyone a good night, and let's conclude the webinar. Thank you so much. Thank you.
Right.
Thank you so much.
Thanks.